Hi, my name is Sazia Malik, and I will be discussing prevention of hospital admissions today. So, brief overview of what hospital readmissions really are. A definition for hospital readmission is a hospital stay following an original admission and discharge within a certain time frame. A readmission can occur at either the same hospital they were originally admitted at or a different one, and it can involve planned or unplanned surgical or medical treatments. Obviously, when the patients are in the hospital, they're very grateful for the care that they receive, but they're always eager to return back home, and they certainly do not want to be readmitted days or weeks after discharge. Yet that's exactly what happens millions of times a year, and that is why hospitals are now highly incented to reduce these high-cost readmissions, most of which are obviously preventable. Statistics on hospital readmissions. According to the Centers for Medicare and Medicaid Services, there were 1.9 million Medicare readmissions in 2010 at an estimated cost of $17.5 billion. And studies show that about 1/5 of Medicare beneficiaries discharged from a hospital were re-hospitalized within 30 days, and more than 1/3 were re-hospitalized within 90 days. And all of these could have been prevented. The causes of hospital readmissions can be lack of patient and family teaching, inappropriate discharge teaching. Some patients don't follow their medications, they don't adhere to their medications, they don't follow up with their primary care physicians or specialists. And that's why prevention, begins with a thoughtful, comprehensive hospital discharge process that includes medical reconciliation, extremely clear discharge instructions, and strong encouragement to schedule follow-up visits with the patient's primary care physician. This is so important. And it also requires better care coordination in the ambulatory care setting. This is a problem in the fee-for-free services enrollment, where reimbursement for coordination is often lacking, and in the medical home model, where some of those dollars are available, the primary care physician can better manage post-discharge patient care transitions. Still, without robust technology to ensure physicians are notified of discharges and to help them synchronize with hospitals and other members of medical home program, the onus for coordination too often falls on the patient and his or her family. So there are a few ways we can, prevent hospital readmissions. One of them being implement rigorous disease management for high-risk populations. These programs should be designed using the latest evidence, disease-specific, and focused on keeping selected individuals with specific comorbidities as healthy as possible. That's our ultimate goal. It's very important to apply evidence-based approaches to commonly occurring conditions as part of rigorous disease management program, because this reduces the cost and optimizes the quality of care. Patients managed in this manner are generally more educated about their condition and have an established relationship with a health coach or care coordinator. So they are better prepared to be successful in the event that they're admitted to the hospital for treatment, and this can greatly reduce the risk of readmission. The chart here shows population-based care management framework and some of the ways that increases their health risk and the reasons that can decrease their health risk. And in the chart it shows prevention, disease management, and case management. They're very, very important to decrease health risk and decrease readmission in the hospital. Another recommendation, another way we can improve hospital readmission is using technology to improve care coordination. The first role for technology and care coordination is notification. You have to absolutely notify their primary care physicians. Providers need to be informed when certain patients make a significant move through the healthcare system to prevent becoming overwhelmed. And Providers need technology that lets them easily identify which patients are, top, medium, or low priority, and it lets them set thresholds for multiple types of notifications using evidence-based analytics. Once notified of an admission, the care coordinator must have evidence-based protocols available to quickly assess the patient and create a custom care plan. And this step should include a series of questions asked during the admission that provides data to help determine the likelihood of a readmission. And this is very important because the nurses and physicians and everyone in the healthcare system should be working together to actually have the technology improve care coordination. Another recommendation, obviously, is medication adherence. Some of the reasons that patients don't adhere to their medications is because the patient feels like they don't need it, they can't afford it, they're not educated on the side effects that the medication provides, which is why sometimes when they have certain side effects, they discontinue taking the medication. Some of our older clients, they forget to take their medications. They don't have enough information on the drug, and sometimes they don't have the satisfaction that the drug should be providing them, or they don't have social support. And one of the biggest reasons is they have a poor physician relationship, so they don't have that trusting relationship with their primary care provider. And we all know that a hospital stay can be very confusing for patients and family members, especially if patients are on pain medications. Disorientation can be very common, making it extremely difficult to understand complicated discharge instructions, especially when it comes to medications. Which is why when we had previously discussed why it's so important to provide appropriate discharge teaching to your clients and their family. So whoever is addressing this patient, whoever is dealing with this patient, they should have the following things to make sure that the patient is following through with their medications. They need tools that integrate with the physician and other systems to ensure an up-to-date medication list at admission. They need to have an ability to create a comprehensive discharge plan, including a medication list and other instructions that can be adjusted based on patient needs. There should be a system that can analyze the updated list and alert the clinician to any potential drug-to-drug or polypharmacy issues. They should have data and tools that can inform the clinician about the historic level of patient adherence so that more rigorous controls and monitoring can be put into place as needed. They need to have access to pharmacists for an in-depth education and medication review for patients who need it, and inclusion of the medication list in any chronic disease management care plan or program. These things are so important for the patient so that they can actually follow through with their medication, and so that they're not readmitted, to the hospital. And that is basically it for the presentation. Just remember that it is so important for us to make sure our patients are doing well and we provide quality care to our patients. Hospital readmissions can be very costly to our healthcare system, especially with the type of economy we're in right now. So providing quality patient care and making sure that our patients are doing well even after discharge should be our primary goal. And that is all for our presentation. If you have any further questions about hospital readmissions, I've linked my email below, and you can always contact me through that.